Good afternoon and welcome to the Children and Family Affairs Subcommittee. Thank you all for joining us today. And we're going to begin with a prayer and a pledge. So if you would please stand for the prayer and remain standing for the pledge. Representative Jernigan, would you please lead us in the prayer?
I'd be happy to do so. Let's bow our heads and go to the Lord in prayer. Lord, thank you just for this day. Thank you for the opportunity to be part of a government that is created for the people, by the people, and to be able to come here and air out our grievances and air out what's positive about government, and to be able to have our ideas and our feelings and our thoughts flow in a manner that's respectful. And dear Lord, I ask that you be with colleagues that aren't here today and be with them. And I just hope you would bless this meeting today. In Jesus' name we pray. Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Mr. Clerk, would you please call the roll?
Representatives Bricken, Farmer, Gant, Garrett, Harris, Jernigan, Powell, Stevens, Chair Lady Littleton.
Here.
Madam Chair, you have a quorum.
Thank you. Members, do we have any personal orders? Seeing none, we have 6 bills on the calendar today, and we're going to do a little housekeeping. Number 5, House Bill 2003 by Chairman Farmer is taken off notice. And back to number 2, 2067 by Representative Butler has requested to roll to the heel of the calendar. So now we're with our first item, number 1, House Bill 1303 by Representative Thompson. I don't see him, so we will roll him. Do we roll him to the bottom of the hill? Or?
To the hill.
We will roll him to the hill. Next is item number 3, House Bill 2710 by Representative Garrett. Representative Garrett.
Second.
Properly motion and second. You're recognized.
Thank you, Madam Chairman. Committee, this piece of legislation involves conservatorships, and I practice in this field. And what happens in a conservatorship matter, usually you begin with a form from a physician that says and agrees and concurs with the petitioner who's seeking a conservatorship on behalf of this form says that the person that you're seeking the conservatorship upon is in need of a conservatorship. And typically, they're notarized. And what we're running into is that a lot of doctors' offices may not have a notary. And so we're changing that requirement from a notary, where the physician has to sign that particular form under oath with penalty of perjury. So in order to satisfy that requirement, that document was signed, reviewed by the physician that agrees that this particular person is in the need of a conservatorship. With that, Madam Chairman, I'll be glad to take any questions.
Are there any questions for Representative Garrett? Seeing none, are we ready to vote? All those in favor of House Bill 2710, say aye. Those opposed, no. The ayes have it. You move out to civil full.
Thank you, Madam Chairman and committee.
So next we have number 4, House Bill 1994 by Representative Stevens.
Motion.
Properly motion and second. You are recognized, Representative Stevens.
Thank you, Madam Chairman. This bill came from the Bar Association, from a group that practices in estates and conservatorships. And what the purpose of it is to establish a procedure to transfer a conservatorship or guardianship from county to county. There is a process in the code now to transfer from state to state that each state has adopted. But in Tennessee, the counties do it differently if you want to move from one county to another. So this bill will establish a uniform process throughout the state if people wish to transfer a guardianship or conservatorship from one county to another.
Representative Garrett, you're recognized.
Thank you, Representative Stevens. Thank you for bringing this piece of legislation. I appreciate you bringing it before me just to kind of get some ideas. And I just want to make sure that typically the conservatorship is established. And if the ward moves, let's say, for instance, from Williamson County to Sumner County, and the the conservator lives in Sumner County. Now the ward lives in Sumner County, so there's no reason to have it subject to the Williamson County Court. They can transfer it with your new legislation, but it doesn't require them to litigate all the facts of the reason why the conservatorship exists in the first place. But the ward is certainly able to do that under your particular legislation here, but it's not required. Am I understanding the legislation correctly?
Thank you, Madam Chairman. That is correct. They can already transfer from county to county, but each one does it differently. So the attorneys don't know what each court does. This sets up a uniform process, and the wards already have a right to challenge at any time whether they should be in a conservatorship, and they would have the right to do that at the hearing if they choose. But if they wanted to do that anytime, they could do that. So there's no new litigation about the facts of the case. It's just simply whether the ward has moved or should move to a different place, and it's more convenient to have the case heard where the ward will be or the conservator will be instead of where they used to be.
Perfect. Thank you for that. Thank you for the clarification. I appreciate it.
Any other questions for Representative Stevens? Seeing none, are we ready to vote? All those in favor of House Bill 1994, say aye. Aye. Those opposed, no. The ayes have it. You move out to civil full. And next, I think I need to pass the gavel off to Chairman Farmer.
Members, that brings us to House Bill 2788 by Chair Lady Littleton.
Motion.
We got a motion, we got a second. Chair Lady, you have an amendment that needs to go with this, or is it clean?
It's clean.
All right, sounds good. Members,
I
are
can't
we?
believe that, can you?
I wouldn't expect anything less from you, Chair Lady. And you're probably recognized, ma'am.
Thank you. This is a bill for a cleanup bill for the CAC at the local level of the Child Protective Investigative Team, which we call CPIT members, have well-established data sharing capacity in the TCA. With the new statewide data systems being developed at DCS, the DA's General Assembly Conference, and the Administrative Office of the Courts, this bill is intended to address all the statewide agencies that represent the CPIT partners. The bill is permissive, not mandatory, so that the named statewide agencies can establish data sharing agreements as statewide data systems are fully implemented.
And thank you for that explanation. Members, have any questions for our Chair Lady? Any questions? Seeing none, we ready to vote? Any objection? Seeing none. All right, looks like we're ready to vote to send House Bill 2788 to Civil Justice Full Committee. All those in favor say aye. Aye. Opposed say no. Ayes have it. Bill moves on. Thank you.
So it looks like Representative Butler isn't here, so we're going to move him to the Hill. So next we have number one, House Bill 1303 by Representative Thompson. Properly motioned and seconded. You're recognized.
Every year, the State Department of Children's Services collects data regarding child adoption, child abuse, neglect, youth in transition, and the foster care system. This information is accumulated and transmitted to the Federal Children's Bureau as a condition for federal funding and grant programs. So this bill would not only require that we continue to report this information, but also that the department would make this information available in their public website. And this is a means of ensuring that there's more transparency and visibility in our state departments, and to make sure that we continue to invest in our children of the state and provide extra clarity to the public on how we're accomplishing that goal. And I'm happy to answer any questions.
Seeing none, are we ready to vote? All those in favor of House Bill 1303, say aye. Aye. Those opposed, no. The ayes have it.
Thank you, Madam Chair and Committee.
You move on to civil full. So it looks like Representative Butler must be. Do you have? No. I've texted him, so can we just recess for a short minute to see if he shows up? So we're going to be in a brief recess. Representative Farmer, you recognize.
Madam Chair, I may be out of order, and I think this is okay to do while we're out of session, but I believe we have a leadership group from the Tennessee Bar Law out there with us today. Want to thank you all
Oh.
for being here and leaving, I guess, looks like. So, cause I right at a good time. Anyways.
Bye bye.
Bye-bye. That's right.
So we are back in session. We decided to summer study you. Next up, we have House Bill number 2. It is House Bill 2067. Representative Butler, you're recognized.
Thank you, committee, and thank you for not summer studying this legislation. I appreciate that. So,
Do we hear a motion? Probably second in motion. And I see that you have an amendment, but it was a little bit like 1 minute untimely filed. So if it's okay with the committee, we'll go ahead and hear the amendment. So we're going to hear from the amendment. Does it make the bill?
for the most part, the
Okay.
amendment makes the bill.
So let's go ahead and put the amendment on. It's amendment 13710. Is that what you
Yes,
have?
ma'am.
Okay. It's properly motion and second. All those in favor of amendment 13710 going on to House Bill 2067, say aye. Those opposed, no. The ayes have- oh. You're recognized.
If you could just speak specifically to what the amendment actually does, that would be great.
Well, the amendment really makes the bill in that it establishes a grant program for counties to apply to a grant program like we've done in other things, so that each county could apply for money to install a safe haven baby box in their respective county. So if you look at the physical note, I believe that'll change a little bit now that we've amended it. It should reduce it some. So it would be the responsibility of the county to identify the location, to make sure the location meets the law, and then to apply that information to the Department of Children's Services that will kind of oversee this legislation and administer the grants. Then they would apply that, they would receive the money, and then they would be responsible for installing it, buying it, et cetera.
Representative Gant.
Can you, I guess I've really never seen this play out where I've actually seen it play out, but describe the facility and that process in more detail.
You recognize.
Thank you. Well, we currently have safe haven law in place. It's been in place for a number of years, and there's a lot of locations that are accessible to a woman in this situation that doesn't require a baby box. But I think there are situations where that woman is not going to be comfortable doing a face-to-face handoff, and a safe haven baby box allows that option. I don't know what percentage of women would fall into that category, but there are very specific requirements on a safe haven location. It has to be manned 24 hours and some type of a medical professional there. And I'll give you an example. So Station 17 in Knoxville was the very first baby box location in the state of Tennessee. And it was installed last February. So it's been in there approximately a year, and 2 babies have already been surrendered in that baby box. So the way the safe haven baby box law is written, if that baby is surrendered, whether it's in a baby box or whether it's in a face-to-face handoff, the mother has the ability to retrieve that child, no questions asked, within 30 days, provided that the baby doesn't have any underlying issues, it's not been abused, it's not been neglected, it's not on drugs, et cetera. Then she can come back and say, hey, I want to get my baby back. Statistics show us that over 96% of the time, the mother never returns.
Representative Gant.
So what happens from the moment in time where that baby is dropped off, the care, custody, and control of that baby? Describe what happens from that point forward.
Representative Butler.
Thank you. The current law requires that baby to be taken to a hospital facility, a DCS to be contacted. Obviously, DCS arrives and takes custody of the baby. And there's been some instances where the baby may require some medical care. It could be drug addicted or whatever the case may be. Hospital will treat that baby, and once they release that, then DCS would have custody of the child to place it in a foster family that they've already most likely got on the list.
Representative Gant.
Okay, and I promise I'm done, almost done. So from the moment that child is dropped off, there's no way for another outside source to come in and kidnap, or I'm concerned about the safety of that child from that moment in time,
Good question.
especially depending on where it's dropped off.
Representative Butler.
Thank you. That's an excellent question. So the way these baby boxes work, without getting into a lot of stuff that may or not be relevant, they have to be connected to an alarm system. And so when the baby box is open, the baby's placed into it. When you close the box, it locks. And so only an authorized person, typically somebody at a fire station or wherever, it could be at a hospital, wherever it's located, they have a key, so to speak, to open that box and get that baby out and retrieve the baby. So once that woman places that baby in that box and closes the door, it's locked and they can't get it back out. But under the safe haven law, if they meet the criteria, they can retrieve that child, no questions asked, within that 30 days.
Representative Gant. Any other
I
questions
got a
for
question.
Representative Jernigan?
Well, Johnny, I hear debating on it. So when you put the baby in and it locks, how are they notified? I mean, is it staying there for 2 hours? Did they check it periodically, or that's
That's a great
Representative
question.
Butler, you're recognized.
Thank you, Chairman Lady. So they're all required to be connected to an alarm system.
okay?
So I believe in Knoxville, that baby was in the box less than 2 minutes the first time, because once that box closes, alarm goes off and they're notified, hey, we got a baby in this box. And regardless of the location, whether it's a hospital or a fire station or whatever, then there's somebody that immediately responds to that alarm.
Okay.
And most of the time, and there could be an exception I'm not aware of, it's just a couple of minutes.
Representative Jernigan.
Oh, no, I'm good. Thank you.
Representative Powell, you're recognized.
So reading over the bill in your amendment, I know it was late being filed, but not too late. We adopted it. I mean, there are specific parameters about in your bill to make sure that the actual alarm system is sufficiently checked and staffed and all that. Is that correct?
Well, under the law and most of the companies that manufacture these baby boxes, some of them have some extremely stringent requirements. For example, one of them requires testing to be done 7 days in a row on the baby box before they will officially certify it to put it in use. So there are very strict requirements on when you install this baby box, making sure it is connected to an alarm system, making sure the alarm system works properly and it actually notifies it. So the most babies will probably be in the box less than 2 minutes.
And I've got one other question. You mentioned that a lot of the the parent, mother, father, whoever drops off the baby could be someone else. They want to oftentimes maintain anonymity and I didn't say that correctly, confidentiality. Given that these are very public places, oftentimes like a police station, fire station, I would assume there would be some video potential. Is there any sort of fear, I guess, that someone might gain access to that video to try to figure out who the baby belonged to? Does that ever come up?
That's not been addressed. Obviously, a woman in this situation has immunity under the law, whether it's in a safe haven baby box or whether it's in a safe haven location where it's a face-to-face handoff. And my personal view on it is, if we have a woman that does this, leave her alone. If she surrendered that baby, let's leave her alone. I don't know why we need to bother her. And she's in that situation. I wouldn't want to call any attention to her if we don't have to. I don't know about the cameras. That's a great question. And that's really going to be up to the county that installs the box. I'm not aware if there's any cameras at Station 17 in Knoxville. I don't think there's any cameras on that facility where that box has been used twice already in the last year.
You're recognized.
I appreciate that. I agree with your philosophy on this, and maybe I know that's not covering your legislation. Maybe somebody can look at in the future, but I have no issue with this. I'm supportive. Thank you.
Representative Garrett.
Thank you. Representative Butler, you've been very good answering questions. Got two, maybe relay. My first one is this wouldn't affect if they already have one. If they see a need for two, could there be a place that gets more than one? And then if they can, is there a need for more than one at a same location? I mean, if you got a fire hall a mile away, I see that may be a more appropriate, but I guess if there's one that's already there, can they get more than one under the grant proposal?
You're recognized.
Well, my intention was, let's just say we have Williamson County that may already have one. I don't know whether they do or not. I think the grant would be opened up to where they could put a second one in somewhere else. I mean, from a personal logical standpoint, I think you could probably put 10 of these things in Shelby County. You could probably put a dozen of them in Nashville. There's lots of places that could have several of these baby boxes put in. And it's really going to be up to the county. I mean, it's going to be a local control here. They apply for the grant. The department would have to approve that location and award that grant. But I wouldn't put them a mile apart, but I could think 10 miles apart.
You're recognized.
Thank you for that. And then on the related discussion, I think it, gives us just a little bit of pause of leaving a baby in a box, right? And 2 minutes later, somebody comes up, which is good. I'm glad this exists. I'm going to support your legislation because we need this there for that option to make sure the baby is safe. But I guess my other question is, at a fire hall or a police station, I mean, before this thing is installed, when they've gone through it working 6 or 7 times to make sure the alarms work, my assumption is once that baby's in there, that alarm's automatically triggered. And then does either current law, I don't believe your legislation addresses this, I'll make sure that there are specific people that have the authority to open that up. It's not just and I don't mean to sound bad, but the person on duty at the fire hall that has it, or is it that simple that anyone from the fire hall, and lots of times there's a lot of people in and out of the fire hall that have the specific authorization to remove that baby, and then that baby at that moment, whoever that person is not a person within DCS, and that person is required to take the baby immediately to the hospital or some medical treatment facility, and then that's when DCS would take control. So I'm just wanting to know, from the minute that alarm goes off, specifically who's authorized to remove that baby, who is that, and then when does DCS come in play when they actually take that particular baby in their custody?
Representative Butler.
So let's use the fire hall, for example. Any fireman that would be on duty would have access to that baby box when that alarm went off. So part of the original law requires there to be some type of medically trained individual at that location. And so most of your firemen have EMT, EMS type training. And so it's going to have to be somebody that's authorized to even be employed there. So if it was a police department and somebody at the police department, I don't know how their specific procedures are going. I have some other legislation that expands where these boxes can go. And most of those places will have to have an internal policy in order to deal with this. But DCS should be notified immediately. I would think, and just from a personal standpoint, that you would want to address any medical needs immediately and then immediately notify DCS. And if you were taking a baby from the fire hall to the hospital, I would think that they would be calling either an ambulance to make the transportation, or they did it themselves, that DCS would be notified in the process of transporting that child. And I also want to point out, and you kind of alluded to this, I just have some statistics here on the number of babies that have been abandoned. And just last month in Casey, Mississippi, if you saw the news article, there was a baby left out by the dumpster. In Yonkers, New York, a baby was abandoned in a hallway on February the 6th of this month and this year. And in Georgia, we had a baby left in a plastic bag in June of 2019. Polk County, Florida, abandoned outside a trailer park, January 23. Houston, Texas, abandoned in a shed, September 22. Orlando, Florida, 3 different incidences in Orlando, abandoned at apartment complexes. Springfield, Massachusetts, a baby abandoned on a cold winter night in March of 23. Chicago, Illinois, abandoned at an elementary school in September 23. Birmingham, Alabama, a little baby was abandoned in the woods and found by a dog walker, December 21. And so if we provide these types of places, I think it's an option for a woman that's in a bad place. And that's why I mentioned that I would leave her alone if she's done this. I've had some discussions with DCS, and well, if the baby's drug addicted, we should prosecute. And I'm like, just leave her alone. Why waste the resources? If she's in that situation, let's leave her alone. So anyway, I'll renew my motion.
Representative Harris, you're recognized.
Thank you, Chair Lady. And to the sponsor, you mentioned that this amendment changes the fiscal note. What number did we have? Because I didn't get a number yet.
You're recognized.
That's my own personal assessment. I think it'll still be around the $2 million dollar amount, because if you figure up all the counties and put one in each county, these things run about 16,000. I think it would remove the administrative costs, because the way the legislation was drafted prior to that, it required DCS to go out and find these locations and then cooperate with the locals and placing them. And really, I think that's too bureaucratic and too difficult. Let the locals who know their community say, hey, this is a good place to put this baby box. Let's apply for this grant, and they handle it themselves. And so I think that will still probably put it at around $2 million, but it will reduce the other portion of the fiscal note.
You're recognized.
Thank you. Is there any funding allotted for marketing or advertising this so that individuals know about the baby boxes?
Not specifically in this bill. I think having some marketing, not only for the Safe Haven baby boxes, but for the Safe Haven law in itself, where you can hand-to-hand drop off a baby. I think all of that should be included, and I wouldn't be opposed to finance adding some additional dollars in there to promote not only the Safe Haven baby box, but to promote the Safe Haven laws themselves.
Recognized.
I know we look at a lot of different legislation throughout the year, but for some reason, this bill seems like the one that Representative Zachary already did, if I'm not mistaken. I feel like I remember a year where we actually did the baby box like a Safe Haven law.
You're recognized.
Well, the Safe Haven law has been in place for a number of years. This legislation is to capitalize on the ability to put more Safe Haven baby boxes out, because we know they work. Knoxville is a prime example of that. We've already had 2 in a year surrendered in Knoxville. So we know these work. We know women are in a situation where they don't really think they have any other option. And so I'm not aware of any other legislation that's been carried like this.
Thank you.
I have just one question. If the mom comes back, how do you identify that she truly is the mom?
I don't know to be facts, Chair Lady. I would say that DCS probably has a policy and a procedure already in place for that, and probably would require some type of DNA testing to prove that the mother is actually the mother. I don't know to that for sure.
You're recognized.
Thank you, Chair Lady. And with that question, I know part of what you stated earlier is that within 30 days, if the mother wants to come back without questions, they could be able to get the child back. So DCS technically wouldn't be involved in that process if they're just going to be giving the child back without question.
You're recognized.
That's for them to be able to retrieve the child has to have no harm. It can't be drug addicted. It can't be abused. It can't be neglected. So as long as that criteria is met, DCS is going to be involved immediately. Once the alarm goes off, the baby's being transported to the hospital. DCS has got to be notified. That's part of the current law. So when the baby arrives at the hospital, I would hope that DCS is either there already or close behind to get to the hospital to kind of assess the situation. So DCS is going to be involved at the very beginning of this process.
Okay. Any other questions? If not, we're going to go out of session and hear from some private citizens. So, and some presentations. So we are out of session. If you would come up, we have Senator Overby, Doug Overby. Let's give him a hand for being back in our household. And we have Taylor Senzo and Sarah Turner. So if y'all would please just introduce yourselves and tell who you're with, please.
My name is Sarah Turner, and we are with A Secret Safe Place for Newborns in Tennessee.
Oh.
Taylor Sanzo, I'm the executive director for the organization.
Doug Overby in private practice, representing A Secret Safe Place for Newborns, and was one of the founders of the organization back in 2001.
Thank you, Madam Chairman. So in Tennessee, a safe haven facility is any hospital, birthing center, health department, walk-in clinic, EMS facility, or any fire department or police department that is staffed 24/7. We have over 1,500 safe haven facilities across the state of Tennessee. My job as outreach director is to train and equip every single one of these facilities. So daily, I have one-on-one meetings training each of these facilities how to accept a newborn. In Tennessee, we have had over 128 newborns safely surrendered under the safe haven law. When broken down, that's around one newborn surrendered every other month over the past almost 23 years. So a very significant number. Only 2 of those have been surrendered in the safe haven boxes. While we definitely agree that resources are incredible for these mothers across the state of Tennessee, we feel that as our state, or in our state, we really offer a significant amount of these resources. And something that we are lacking in is our educational push. And we feel that this funding could really help in ensuring that every woman in the state of Tennessee knows about the law, knows how to use the law, and the key points to ensure that that newborn is surrendered correctly and safely, as well as continuing to equip every single one of these facilities. It's a large amount, and we try to train each of them every 1 to 2 years to refresh training. Our hospital systems are much more in depth. We have to get them way more materials and training because a baby could be surrendered in many different places, labor and delivery, emergency room, mother-baby unit. So the training for them is a lot more in depth and materials as well. So we feel that this funding could go in a different direction with helping in that educational push and really bringing awareness to the law. Because if we have these wonderful resources, but nobody knows about them, then how are they being used? Taylor's going to tell you a few of our ideas or examples of things that we feel that funding could go towards.
Yeah, so we feel like the funding impact, if there is funding to be issued in this initiative, would be significantly smaller, but it would be more impactful towards awareness and educational efforts. And some of the ways that we would love to see this play out, and we would love to collaborate with state officials and legislators to do this, and we would be open to any ideas that you all have as well. But we've thought about working with the Department of Education and integrating this safe haven law information into state curriculum so that it ensures that all high school students at some point throughout their high school career are exposed to this information at some point and know that the law exists, the rights and protections provided, and the types of facilities that embody the law. We also feel that an awareness ad campaign, given just the current state of social and streaming services, we feel like an awareness ad campaign would be really beneficial for us to hone in on these streaming services, social networks, and just media outlets, billboards, forward-facing initiatives that we could get in front of these women to tell them about the safe haven law and the options provided. And then we would also love to integrate. While our organization is located in Blount County, Tennessee, we're the nonprofit that serves the entire state. So while we would love to be as prominent as we are in the East Tennessee region, we would love to initiate and build task force in different parts of the state that would basically act as extensions of our board and our committees to raise awareness and perform educational efforts within their respective communities. This would involve paid speakers that would be going into these school systems, speaking in front of these students, going into these outreach efforts amongst their communities and speaking to the safe haven law and raising awareness. We just feel that the opportunities are unlimited here, and the funding could be better served in this direction.
Thank y'all very much for being here today. We appreciate that. So, especially you, Senator Overby.
Thank you, Madam Chairman. And as I listened to the presentation by Representative Butler and the questions, it actually warmed my heart to hear the number of questions and the amount of interest that the members of this committee, of this subcommittee, have in this statute. I was a member of the House in 2001 when this law was originally passed and was one of the co-sponsors of it. And I can still hear some of the discussion about, well, how many babies are you going to save? And I think Representative Farmer, some of us would say, well, if we only save one baby, passage of this law, the safe haven law, would be worth it. So to hear that the number that has been saved since 2001 to me is clearly amazing, and it exemplifies that the law is working and serving the purpose. And I compliment all of you for being interested in it, and Representative Butler for being interested. I think the point we are here to make as far as this specific legislation is, we all know the state resources are limited and need to be allocated to where you can get the most bang for your buck, for the buck. And so each year the state does appropriate. You'll be amazed at this number. The state appropriates $49,000 to a secret safe place for newborns. If the Department of DCS were having to do this same work, you might imagine the allocation might be even greater than that. But a secret safe place for newborns serves the entire state and raises the bulk of the of their money through contributions and donations from private individuals, just like the members of this committee. And I know you're going to cut me off, and I apologize for
That's
getting
all right.
long-winded, but this is a really important subject. Thank you.
Representative Powell, you're recognized.
So just to be clear, your feeling is that your organization is doing a very sufficient job. And obviously, you laid out some pretty significant numbers. They're very impressive. I commend you for that. And you feel like this, in some ways, is I want to say, not necessarily the best allocation of resources, dollars spent, taxpayer dollars spent, to serve and hopefully save the most babies. Is that correct?
You're
Yes, that is
recognized.
correct. Sorry.
And
You're recognized.
just out of curiosity, I know we had a lot of questions about if anything had ever happened to the babies. Are you aware of any issues ever occurring under the programs that you've implemented with any children?
So,
You're recognized.
oh, sorry.
So,
So
you're good.
sorry.
You're good.
So when we go through in the training process with each of these facilities, we instruct them on how to accept the newborn, things to look for to see if there's any harm done to the newborn. A lot of times that can't be seen until they're at the hospital. But from the most part, well, we've never heard of a mother being turned away from a safe haven facility, anything like that.
And never any issues with the baby too, that you, I mean, from being the way you operate, from the baby being dropped off, more or less.
Recognized.
No, there has not been an issue under our awareness.
And I appreciate your indulgence here, Madam Chair Lady. One last question. Do you feel like you're able to adequately, I represent an urban area, and I'm very familiar with this, and appreciate what you do, but do you feel like you're able to adequately cover rural parts of the state, and that we could have other initiatives to help rural communities?
You're recognized.
I agree that in rural communities, there aren't as many resources available for mothers. I think that there could be other things brought into those rural communities to offer more options for those mothers, whether opening up other facility options in those areas. But definitely just, I think, making sure that it's not just the box, but also a facility.
Representative Harris, you're recognized.
Thank you, Chair Lady. And so Representative Powell has already kind of basically asked the question I was going to ask, but for you looking at this funding amount and knowing that this is only earmarked to like help as far as like newborn safety devices, this doesn't directly impact you all as far as funding that would help with resources for you, for the work that you all do.
You're recognized.
Directly, I would say with the funding in addition of the boxes, we have seen definitely in media coverage, it take away from facilities. An example, in Jackson, Tennessee, there was a newborn that was abandoned last year. And in that county, they were fundraising for a baby box. And so in any news media coverage from that, they only said we are planning to get a baby box and failed to mention I believe they have over 60 safe haven facilities within that county and their surrounding counties, and nothing got mentioned in it. So I think it distracts from the existing facilities when that does happen. So that then does affect the work that we are doing.
Representative Garrett.
Thank you, Madam Chairman. Thank you all for being here, sir. Thank you for being here as well. Just a couple of comments or questions. We typically talk about funding in a different committee, right? And so right now, so taking that aside, since we're kind of the policy side of this at the moment, I mean, I'm assuming that that's your opposition to this, is the funding needs to be somewhere else. But if we take that out of it, and as the senator suggested, having one baby that may not know about you all, because we can spend a lot of money on awareness, marketing, and you still not reach somebody, right? But if they know about something at the fire hall, that they drop off this particular baby at a fire hall that can be safely done. From the policy perspective, does that make good policy?
Recognize.
So with the baby boxes, we have noticed that the safe haven law is a confidential process. It's what we are offering these moms. It's the great thing about the safe haven law is that confidential anonymity through surrendering correctly through the safe haven law. With the surrender that did take place in Knoxville, there was immediate news coverage saying the exact location, time that the baby was surrendered. So we are fearful that that would continue and then could potentially lead to somebody finding out who the mother was.
You're right.
So with that, you're against the policy as well of having a safe baby drop off at a fire hall or a police station. With that concern, you are against what's already in place. Would that be accurate? I don't want to speak for you, but I just want to make sure I understand where you're coming from. Again, without the funding being part of this.
I think that offering resources to mothers is amazing. And like you said, one life saved is a life saved. And that is the most important thing. I think that baby boxes hand to hand, that's amazing. But I do think that there are a lot of questions that do come up. Another in the law, the mother must surrender the baby. How do we confirm that that was the mother surrendering? What if it was the father? What if it was somebody else? There's no way of finding that out.
Thank you very much. Thank you.
Representative Gant, you're recognized.
Thank you, Madam Chair. So I guess I'm kind of listening to the conversation as we're having it here and what Representative Garrett just mentioned. So the funding part of it, had you rather see, and I think the the sponsor alluded to there was a $2 million physical cost to the legislation, I think. Is that correct? And you'd rather see that money better utilized in a nonprofit, which I assume you guys are a nonprofit, to better provide better oversight to this process. Is that a correct statement?
So I think that it would be a lot less than the 2 million to do what we're wanting to do with our educational outreach. But yes, we feel the funding could be better utilized towards us in our outreach efforts, but also with partnering with the state in those outreach efforts, because getting that across the state and implemented to every county would be a group effort.
Okay.
Representative Gant.
Okay. Okay. I still have some questions, but and some concerns here, and I think I'll save those for the sponsor.
You're recognized.
Thank you, Madam. Thank you, Madam Chairman. We understand, I guess, Representative Garrett, we understand the policy decision to have baby boxes has already been made, and that it is in the statute. So we're not here really to debate whether there should to debate that policy. That the legislature has spoken on that policy. So in a way, and not to sound argumentative, but you and I are both lawyers, and that's what we generally get paid to do. So as far as this one piece of legislation, it's hard to divorce the policy from the funding. In other words, the policy really is the funding. Where could valuable state resources be better allocated? And that's your all's decision to make. And we're sort of in the he who is not against us is for us. So I think we're all on the same page of wanting to promote the safe haven law and the surrender of unharmed babies. But as to this question about if the state were to invest $2 million, how is that investment best made? And certainly this organization, I think to boil down the argument, is in outreach and education, because there are, not counting the baby box in Knox County, there are 1,500 locations. And if we could better publicize those and better, if I may, Madam Chairman, when we passed this bill in 2001, we provided nothing, no money, zero money, no outreach, no funding to DCS for outreach. That's why this organization was formed in 2001, was to provide that. When I say we, I mean the legislature, sorry. This organization was formed in order to start as a nonprofit 501c3 in order to start raising money to do outreach toward young women on one hand, and outreach toward those facilities that are safe havens, because they have certain responsibilities under the law. And they needed to know what those responsibilities were, as well as young women needed to know their options under the law. And so that's really our point of view, is to continue the push for outreach. And until we started meeting here recently, I didn't realize there were 1,500 safe haven locations under the law, or 60 in Madison County, Tennessee, or however many there are in Davidson County. I suspect there are plethora of locations, but I think our point of view is we would like to see funds invested in outreach to young women as well as to the providers to make sure they know what they're supposed to do once a baby has been surrendered. Thank you, Madam Chairman.
Representative Farmer, you're recognized.
Thank you, Madam Chair, and appreciate you all being here. So just so I can understand what everybody said, Representative Butler, and I'm trying to take the two positions here, which as I understand it, y'all are working together, you're on things. So, but what I'm hearing is, and correct me if I'm wrong in just a second, instead of more baby boxes, if that monies are redirected through an organization similar to yours, with the promotion of the existing safe haven facilities, I'm hearing that maybe we don't need more baby box drops available. Is that where we're going here? I guess direct question is, do we need more baby boxes out there? And number two, whether we do or don't, if we don't, is redirecting whatever dollars may be out there. And as I understand it, you all are privately funded right now. Is that correct? So do you receive any state dollars right now?
The appropriation of $49,000.
Okay, so there. All right. So I may have just confused everybody. But I'm just trying to understand how things are working together. And I'm kind of seeing maybe you all going direction, hey, let's let more people know about this, go directly to these providers, and we may or may not need more of the baby boxes out there. So if you just kind of hit me with that just broad answer there.
So in a nutshell, yes, we truly feel that the 1,500 plus facilities already available across the state is a sufficient amount. Now, we understand again that there are rural areas that have a minimized options available, which we feel that there is a 911 dispatch option that is included in that, where women can call 911, disclose that they have a safe haven surrender to perform, and request that they meet her at a disclosed location to perform that surrender. So that is an option for some rural counties, and that was methodically thought through upon the creation of the law for women in these situations, whether they be in rural locations or even women that are under the age of driving legally to a disclosed location. So we feel like it's pretty significantly covered, but we are obviously open to establishing more facilities in those rural areas if they feel like they want a more of a brick and mortar actual place for a hand-to-hand surrender. We feel that the hand-to-hand surrenders are the most beneficial. Like we had mentioned and alluded to just moments ago, there's been 128 so far. So we do feel like 128 women thus far since the law has been created have been able to take advantage of the facility options that are made available currently. And what really the drive and the push that needs to happen is just the awareness and the education around that to become more forward facing, because right now, unfortunately, a lot of that publicity is being centered around baby boxes, which is, again, a wonderful option as a last resort option for these women that feel like they don't have the ability to do a face-to-face surrender. But you cannot, it pales in comparison, the number of baby boxes, even if you were to establish them across the state in these 95 counties, it pales in comparison to the 1,500 plus facilities that are already ready, equipped, and trained to perform these surrenders.
And speaking of, you said you provide the training to accept these children, those little babies. Do you also provide that training to the places that are equipped with the baby boxes as well?
You're recognized.
Thank you. So yes, all of the facilities that could have a baby box in them are also safe haven facilities. So yes, they do receive that training. Within the baby box, there is a packet in there. So we will equip every facility with 2 mothers packets at all time. So it has info for the facility to help them through that surrender process. There's a documentation form in there that they'll give DCS. And then there's a portion for the mother, which is her info under the rights, how to if she chooses to reclaim her baby, how to do so. And then we list off frequently asked questions, things like that we tell every facility that they have to get this to her. Within those boxes, they have something similar to that. Since we aren't the organization that creates the boxes, we don't know what those look like, but it's on the mother to take that versus a staff member handing that to her to ensuring she gets that.
Last question.
You're good.
Do you all know how many mothers have asked and been reunited with their with their babies out of state, out of that 128?
You're recognized.
So we know of one, but specifically, but I do believe that there have been a couple more than that. But I can't speak to a specific number because it is a confidential process. And that's the beauty of the law, is that if a mother feels that she can't do it versus abandoning her infant, she had that baby in a safe place for that period of time, and then allowed her to change her mind and go back and reclaim her newborn. But that is all confidential. So DCS would only have those.
Okay. Well, I appreciate all you all do. And it sounds like you're well educated, well informed, and helping other people do the same. So, and thank you, Madam Chair, for the time of the committee.
Are there any other questions? Okay, thank y'all very much for being here.
Thank you.
Thank you.
So next we have, that wants to be a witness, is Patrice Martin. If you would introduce yourself and who you're with, please. And thank you for being here. 3 minutes.
Thank you. Hello, dear members of the Children and Family Subcommittee. My name is Dr. Patrice Martin, and I come to you as an independent citizen of the state of Tennessee. I'm here today because I care about my state and I care about the issues that affect children and families. In October of 1976, I was abandoned at birth. At the time, my mother already had a child. She was a nurse. She worked a night shift, and she was dating a man at her job secretly and was secretly carrying a child, which was me. At that time, she hid her pregnancy, had me on the bathroom floor of her home, cut the cord, and then put me behind a mall in Pittsburgh, Pennsylvania. I'm here today in opposition against House Bill 2067 for the following reasons. Now, you guys have been through and, done a lot of questioning about it, so I'm just going to cut to the chase. One of the reasons why I'm here is because I believe that it promotes diminished outcomes for mothers. When you are in a mental health crisis and perform this type of action, what you really need, and a lot of the mothers really talk about not feeling supported. I feel as if this bill, if enacted, would direct dollars in a way that would not support mothers and provide actions for the wraparound services that are needed for them. The other thing that I believe, as far as this legislation goes, is that it also promotes abandonment of infants with no regard to the downstream effects and consequences that the child and eventual adult's mental health may occur. I'm a part of the adoptee community, and let me tell you, we have a lot of work to do when it comes to supporting adults who have been adopted in their rights. But one aspect that our community suffers from is complex PTSD from abandonment issues and things like this. There's a study done by Yerkin et al. That talks specifically about the fact that face-to-face, handover, and skin-to-skin contact with the life continuum is what is best. Safe haven laws promote the fact that there is face-to-face contact when there is handover of that child. Leaving someone for even 2 minutes in a box promotes feelings of anxiety within children and abandonment that adversely affects them through their life. These are things that we know. These are things that we scientifically know about children and how they are to be treated in this manner. I thank you for taking the time to listen to me. And I do hope that what I have to say to you not only provides you with a different perspective on this, but I hope that we can work together in making things right for all Tennesseans. And I just wanted to say that 3 other things that I feel need to happen. Funding programs such as Early Head Start and in-home options for moms and cares so they can feel supported early on would do the trick. Partnering with Tennessee Child Care Task Force, which you guys have already put the money towards for child care. My mother's issue was she couldn't go to work. She was the lowest nurse on the shift, and she already had a child. She had a mental health break, and she felt out of control. Build
Ma'am,
stronger
I'm
partnerships.
sorry. You've
I'm
already
sorry.
gone over a minute and a half, so you just have a few minutes.
Okay.
Just a couple things
Just
left.
one more
Okay,
thing.
finish up.
Build stronger partnerships with them, nonprofits and faith communities, and shift dollars to 2 or 3 more positions in the Department of DCS, and do more health outreach in places like Meharry, Vanderbilt, and Tennessee State is doing work on the social determinants of health so we can get ahead of this before it becomes a crisis.
Thank you for being here. Are there any questions for Representative Harris? You're recognized.
Thank you, Chair Lady, and thank you for coming before us. So, for you, in your thoughts, what do you think would have been a better option for your mom?
You're
On-
recognized.
What'd you say?
You're recognized.
Oh,
to
I'm
speak.
recognized.
Yes.
I'm sorry. I really think that the support, knowing that she would support, knowing that the safe haven laws were education around that was even an option, that wasn't there back then. So the direction of dollars and direction of policy and direction of action towards educating the public that safe havens are there, they're in place, is certainly the way to go. Educating a lot of women don't know. They don't know about the safe haven law. They don't know about them, and we need to direct energies in that way and funding that way.
Representative Gant, you're recognized.
Thank you, Madam Chair. So what I'm hearing is through Safe Haven and faith-based nonprofits that there could potentially be that partnership where instead of that child being left in a box, that child still might have a future with its real parents by promoting and working with that parent and helping them along that process to where they may not in the end give up that child.
Ms. Martin, you're recognized.
Thank you. There's the possibility for that. If people, if the redirection of resources is towards some of those more preventative measures, yes, we know that. But in the case that a child ends up in DCS custody, we still want to provide funding so that those programs can be wrapped around those children and not necessarily put in a box. That because we know scientifically that really early on that's not the way to go.
Thank you for coming before us. I know this has got to be difficult for you, so thank you.
Thank you.
Chairman Farmer, you're recognized.
Thank you, Madam Chair. And I want to thank you for being here and, looking back and hearing your story. You were here for a reason and a purpose. There's a reason that your mother chose you and chose life and chose to have you. And for one of those reasons, and I'm sure you've done many things in your life. I mean, you're obviously sitting here today educating us on some things, some hardships that you've been through, that your mother went through as she was having you, carrying you through as working. And like you said, just the way things just turned out. And I'm sure it was probably the toughest decision she's ever made is to leave you where she left you. But you know what? You're here for a reason. And I just want to thank you so much for being here and have this courage to come and talk to us and be in front of us and every other person looking live streaming here for the Tennessee General Assembly today in this committee. But just want you to know how much I appreciate you being here. Thank you for all you do.
Any other questions? I too want to thank you for being here. It's a strong story and takes a lot of courage to come in front of strangers like you have today to tell your story. So thank you for being here. Any other questions? Without objection, we're back in session. Representative Gant, you're recognized.
sponsor.
Sold me.
So if we've got 1,500 boxes across this state now, and we've got nonprofits that are wanting to get involved in this process, what actually is your legislation doing?
You're recognized.
Well, I appreciate our comments from our folks. I appreciate what A Secret Place does. And while this legislation has been in place for over 2 decades, we've already seen the Safe Haven Baby Box save 2 lives in Knoxville. We don't know how many have died being left out by a dumpster, left in the woods, whatever, or thrown away. It's hard to measure that. So it's really difficult to really truly know the impact of how many babies these boxes will save. I mean, I gave you a list of a number of children that have been left outside, especially in the wintertime. They're going to be susceptible to the elements. While I support what they're doing, I think this is another tool to give an option to a mother in distress. So they're not left out by a dumpster. They're not left outside in the weather. And all this does is expand an opportunity for a mother that doesn't want a face-to-face handoff. I'm not opposed to that. Matter of fact, I support that. I support what they do. But how many babies do we not know have died somewhere because they've been abandoned and left? And if we save 2 babies in Knoxville, I think that's a pretty good example of what we can save across the state with Safe Haven Baby Boxes.
I guess but if we've got 1,500 boxes already, and I'm just kind of perplexed that, we could better use the $2 million to help private nonprofits engage this process. And we've already got a system that's got 1,500 baby boxes out there, and we're not taking that away. But you're asking us to invest $2 million additional in additional baby boxes that could potentially, that money could be better used in nonprofits, especially faith-based nonprofits that could engage this process.
You're recognized.
Let me clarify. There's 1,500 locations, not baby boxes. So nursing home, fire station, et cetera. Those are approved locations. And the way the current law is drafted is it provides the immunity for the mother to be able to drop that baby off and then retrieve that baby. So all those locations don't have baby boxes. This is a box that is put in one of these approved locations where the mother has the ability to leave that baby anonymously. Obviously, a face-to-face handoff is the best. I don't debate that. I agree with that. But in Knoxville, we've had 2 left in a box that may not be alive today. They could have been left at a dumpster or out in the cold and just died. So we don't have these baby boxes, but in a handful of counties right now. This would allow a grant program to where we could expand the baby boxes. It's not doing away with the locations. It's providing an anonymous location.
Okay, and who would be expanding the boxes?
You're recognized.
There again, it goes back to the county. So if Williamson County wants to put a baby box in, the county would apply for the grant. The grant would be awarded to them. It was their responsibility to identify the location, to make sure the location met the legislation and the requirements of the law. And then once they received the money, it would be up to that county to implement and install that box.
You're recognized.
And so to do this, only putting additional boxes out there is going to cost $2 million?
You're recognized.
The baby box is $16,000 a piece. And I know that's round numbers because it depends on the building that you're installing it in. Being in the construction industry myself, a lot of it's going to depend on the structure of the building, what they've got to do to actually install the box in the building. They've got to cut a hole in the side of the building to install the box. It's got to be connected to the alarm systems and some other things. It's got to have electricity. So the grant money, if any expenditure that was in excess of the grant would be the responsibility of the county. But I believe they've got more than enough money to allocated for this in their budget to cover these boxes. And it's going to be on a first come, first service basis. So if they determine that the box is only going to cost, say, $14,000 and they apply for $14,000, then that's all the money they get. That would be great because it would allow more boxes to be installed.
Okay. Thank you, Madam Chair.
Any other questions? Representative Powell, you're recognized.
Thank you. I just want to tell the sponsor, I appreciate where your heart's at on this. I truly do. given the testimony we heard, I do have some concerns. And knowing, how limited our resources are, and I know that's not obviously up to this committee, but also just some of the policy things that I heard, pretty powerful to me. So again, I appreciate your passion on this issue, and hopefully we can continue to save as many lives as we can in the state for these babies. But I just think there's better ways to do it. Thank you.
You're recognized.
Well, and I appreciate your comments. But I could argue that the babies that are in Knoxville would not be alive today if it hadn't been for that Safe Haven baby box. While I agree with their hand-to-hand exchange, would those babies be alive in Knoxville today had that Safe Haven baby box not been there? We don't know. Let's hope they would. So how do you put a value on saving 2 babies' lives in a year's time frame just in this state? That doesn't apply to the other states that we're dealing with. And not every situation is going to work out perfectly. I agree it would be good for the mother to receive some counseling, but she may not be in a place to get that right then. We have lots of pregnancy resources, and I can think of 2 or 3 organizations right off the top of my head that are in Middle Tennessee that would provide that type of counseling to a mother that has abandoned her child, whether it was at the Safe Haven baby box or whether it was face-to-face. They offer those services now. They have a pregnancy clinic that offers those types of services, not only to women that have abandoned babies, but to women that have had an abortion. They provide the aftercare to deal with that. So I think if we can save 2 babies in Knoxville with 1 box, how many can we save with 95 of them? Thank you.
Representative Jernigan.
Thank you. When I came in to committee today, and I thought, well, we're just gonna come for this, and we'll just let it go to finance and see what happens. I've had a paradigm shift here, and a different way of thinking on, and I understand what you're saying about the box and the 2 in Knoxville, but who's to say with $2 million in resources, the education that they would have went somewhere for that. And I'm struggling now after hearing this testimony, because I'm foreign to all this, that I would like to have that money go to another place than putting a baby in a box. And I hate the way that sounds. It doesn't sound right. And when I can have it go to what Representative Gant said, to a place that's faith-based, and they hand it off, and there's a relationship. And I understand. I think now if I had an opportunity, I'd want that money to go for education to these other locations and not a box. But and like Representative Powell said, I know where your heart is on this, man. I love you for it, but I'm struggling with it right now. So thank you.
I think my colleague made the comment earlier. He said you can spend lots of money to advertising and promoting, and that doesn't mean you're going to reach everybody. So while I'm for promoting the Safe Haven laws in general, what if we don't reach the lady that uses the box? We can spend millions and millions of dollars trying to spread this law, which has been in place for 23 years. And yet we still have Safe Haven box used twice in Knoxville. So I don't know how we put a value, whether it's $2 million or $1.8 million, how we put a value on how many babies we can save with the Safe Haven baby boxes.
Representative Garrett. Representative Garrett, you're recognized. You're up.
Thank you. Thank you, Madam Chairman. Lots of times as legislators, we want our cake and eat it too, right? We've got a funding mechanism to make sure we're completely aware. And then we got a policy that we want to make sure every baby can find a place, just like your example in Knoxville. And I agree with that. And I'm curious, there's a way that we can do both, right? If we can have appropriate, where they can file an appropriation, the folks that were just here, to see if they can increase some funding for their organization to make that awareness possible out of this $2 million possible dollars. My understanding is these boxes cost potentially $21,000 per box. I don't know how many boxes we have, but in quick math, I can't do that in my head. I don't know how many boxes that is, but that's 200, I think, or something. Maybe I can't do that math in my head that quick of what 21,000 versus 2 million, how many boxes that would buy. It's whatever that is, it is, right? My thought is, and my question to you is, if you'd be willing to consider potentially rolling this piece of legislation in order us to look at the possibility, can we do both? Can there be a way where we can cap this? For instance, it's right now the fiscal note reflects it assumes every single county applies for this grant. So the 95 counties would get this. That's where the fiscal note comes from. I'm curious if there's a possible that we can have more discussions on this, if you roll a piece of legislation, to talk about the fiscal impact, or where we could free up some potential dollars that can go towards an awareness program that I think is worth that conversation, since we're still kind of in the early part of session. Would you be potentially willing to do that, to see if we can kind of work with that fiscal note? Because I do see the weight of making sure a mother can be completely aware of what's happening, and those resources exist today. And I would like to see more resources go towards that, or at least it's worth having that conversation. So I'm hoping to see if you'd be willing to do that, to see if we can have those conversations.
Representative Garrett, I think I agree with him. I think because it's anonymous, they use the box. I realize that. And a lot of parents do not, a lot of mothers, they don't ever want to come back to the child, but they have 30 days to do. But I'd rather it be in a box than, like you said, in a trash can, or, in the backyard somewhere. So maybe if you could roll it and we could work on it. You're recognized.
Thank you. I obviously represent a very rural area of Tennessee. And so our resources are very limited. We don't have pregnancy clinics and so forth. So I'm willing to roll it, because I do want to advocate to encourage people to turn it over face to face. But unfortunately, in today's society, we're living in times where a baby box may be the only option that we have. And I would much rather that. And so let's roll it a week. Is that you think that's enough?
I'm happy with that.
Yeah, Maureen?
I think we could work with both, because I think there's an opportunity for both. And I really think that somewhere down the line, there's a need for both. So without objection, we will roll this 1 week.
Thank you, Representative Butler. We appreciate that.
Thank
you.
Is there any other business before us? If not, do I hear a motion to adjourn? We are adjourned. I think there is.